foam rollers. We've got, these are called trigger therapy, aren't they?
Trigger Point Performance.
Trigger Point Performance. These have
tptherapy.com. Are we allowed to advertise?
Can do.
We just have, so.
If you want to send us some, please do. But Dan's here, he's a sports massage therapist, he's an expert. We're going to go through just a few minutes foam rolling on our lower body, because I know a lot of you suffering with pain in your calves and your thighs. Just a real quick follow along with the foam roll.
We'll do it together, yeah.
Put it on the floor.
We'll put them on the floor and we'll start on the calves, all right? So place it there. Calves are in the back of the leg right here. So you're going to sit down. You're going to need to support your body weight. It depends how painful the calf is, right? So if your calf is not painful at all, or you can deal with the pain, you can have more weight on the foam roller, but you can also put your foot down, all right? And you want to make sure you get the different sides of the leg. So you want to go on what we call the medial side and the lateral side.
To turn the foot like that,
Or,
basically.
yeah, or for normal people, just the outside and the inside of the leg. Because the gastroc is split into two bellies. It's got an inside and an outside belly. So you want to make sure you're working on both. And this is going to help the Achilles tendon as well. So for all you runners out there, foam rollering your gastrocs, your calf muscle is going to be really important. You can also actively stretch your toe, so point it and flex it. And that, as we talked about earlier, is going to shorten, and lengthen the muscle. All right, so it's just putting different pressures on the muscle. All right.
Can you overdo this, or do you just go as long as you want? No.
Yeah, no.
Just do like a minute or so each.
Yeah, exactly.
Yeah. And you just said then, I was sitting down, it's less pressure. If I lift up, I've got more pressure, haven't I?
You can feel that already, huh?
What about this?
Yeah, you can do that.
Yeah?
Yeah.
That seems to get deeper, don't it?
Yeah, even more.
Yeah?
Oh, I really don't like that.
And that's the point of this foam rolling. You don't want to be in pain, do you? You want a soft, or
Well, it is painful.
Right.
It is painful. So pain, you need to, obviously not going to be in agony, but a bit of pain is good. It's not bad. It's not going to do any damage. So, I can't do that, Frank, because it's too painful. So I wouldn't do it. I would just, but I can't do it at the moment. But if I did this for a week, I might well be able to.
Right.
What's really good about this as well, and I think I've put it in some posts before, is that a bit of a side note is that you've got obviously tons of nerves running through your body, and you might find that you've got some shooting pain in your leg somewhere. Shooting pain just comes from the muscle compressing the nerve. So this can really help relieve any shooting pain. So for example, sciatica, which comes all the way down the glute to the back of the leg. That's where the sciatic nerve starts in the lower back, runs through the glute, down the back of the leg. If you've got sciatica, get yourself on the foam roller like this, and it will help out. I absolutely promise you. Okay.
So we're now going up to the back of the legs, are we?
So we're going to go back of the leg.
And again, it's just a feeler, I suppose. This bit, because it's thicker muscle, I suppose, relatively on my legs. I feel like I need to push down a bit more.
Yeah.
And that's all right. Yeah, you just go in as. Yeah. I feel like that.
You can even do both at a time.
Ah.
Yeah.
Well, that's where them long ones come in. If you've got a long one at home, they're massive. And sorry, one question I was thinking as you were going there, as we're doing this.
Just holding your hand.
You're going forward and backwards.
Yeah.
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 And that's
all we need.
Best
to do.
way.
Forward and backwards. Yeah.
And we were talking about on the podcast about adhesions, little tears in the tissue.
Yeah.
Would I notice them myself as I'm doing this?
No. So an adhesion. Yeah,
would I feel? That's a tough bit.
It's gonna be more precise than this. It's covering quite a broad area.
Right.
Whereas an adhesion, you're going to feel with a smaller applicator, like a finger. So if you've got a tennis ball,
Sorry, did you want a tennis ball?
That's fine.
I've got a tennis. Do you know I've even got golf balls? Are they good?
Yeah.
Bit much.
So if you've not got a foam roller and you've got a tennis ball, rolling on the tennis ball is tricky. But you might find that having that tennis ball in the area, I can already feel that's just a little deeper because the application is smaller into the area. Does that make sense?
Yeah.
So, yeah. And then you can just hold it. Rather than roll it, you want to hold it, maybe just try and get a bit more weight in there. This is what we would do with a technique called trigger pointing. We would hold the area, the adhesion, and we would try and break that down with pressure. That's what this is doing. But it's quite tricky because it's quite small to roll on it. But, you know, anything you can use like this, like your foam rollers, they're good.
Well, there's I've got a big massage ball here. I've got all different size balls, Dan, which you'd be pleased to hear.
Oh, hello.
Is that good? Bit of a bigger ball. What you're saying is this.
It's not, yeah, I mean, it's not, it needs to be a bit more, it's quite squidgy.
Right, it's too squidgy.
So yeah, I mean, if it was hard, it'd be good size. But like if you've got anything at home with a bit of resistance in there that you can chuck on your muscles, then it's gonna work wonders.
Can we do the thighs?
Two more, yeah.
I always struggle with my quads, the
quads are
thighs.
tough, yeah.
How do I do them?
So you're gonna get onto your front. And again, depending on your pain level, you're gonna just roll your muscles, your quads, over the foam roller.
Oh, it's always
You're
always
right.
a good one. Oh, always a good one.
And again, you can do one leg all the way up into the groin. Be careful you don't go over the knee, all right? You don't want to go over the knee.
Well, you're saying it's muscles, isn't it, not bones? We're
Yeah.
not looking to do the bones, are we?
But you might find that this area here is tender. So just stop a little bit further down, because what happens is you've got your muscle and then you've got a tendon which is attaching into the bone, all right? So you just want to make sure you're getting the main body of the muscle. Last one, Frank.
We've got another one.
If quads are tight, then glutes are going to be tight as well. So you can sit on it, just do your glutes. You can go sideways. This is going to do what's called your gluteus maximus, which is the big meaty muscle.
Meaty one.
But then you've got two more glute muscles, which are deeper and more onto the outside of the buttock. So this one is quite nice.
Is it not? I used to do this like a figure of four, not done this for ages, but
Yeah.
it seemed to open up the glutes a bit more and get.
Yeah, so
like
you're
if I lean,
yeah, so
I can
yeah.
really feel that bit. Ooh.
Yeah. So all you're doing when you're doing this is you're stretching the muscle as well as applying the pressure. So yeah, there's no harm in that at all.
Is it a piriformis, the one I'm going for under here? Is that a?
Might well be, yeah.
I don't know.
It's either your glute medius or your piriformis. So it depends on the action. So I think from memory, your piriformis is an external rotator. So it allows your leg to do this movement. Okay. And your glute medius is a flexor. So it allows you to do this. So if you think about the actions that we take daily, we definitely take this movement because we walk like this all the time. But then if you're playing any sport and you're running, your legs are going to be coming out here all the time, like a tennis player, for example. You might be planting a leg. So the muscles that are tight because of the actions they're doing. So
That's what I reckon. I reckon because we do all the sort of lunging, jumping around. That's why I get the stiff butt.
Yeah. And then that sort of transfers into lower back pain as well. So if your glutes are tight, if your hamstrings are tight, then you might be getting some lower back pain. So stretching like we've just done, showing you with a foam roller, can often ease the pressure in other areas because the muscles are doing what they should be doing. They're loose, they're fluid, they're relaxed, they're not tight, they're not tense, and they're not adhesive. So yeah, foam rollers.
Get the foam rollers out. Just a few minutes there. Did all of the legs, didn't we? Lower body.
Yeah.
How often? Just to finish up. How often would I do that? Or more than better?
The more the better.
Right. Yeah. Thought you'd say that.
This is your sports massage therapist at home, by the way. Okay, so yes, while you can't do trigger pointing and very specific areas, you can do big muscle areas, which is great. All right, so yeah.
I'm loving them. There's
Go for
them
it.
right at the front. Cheers, Dan. Thank you. Keep massaging yourselves. Pays off.
No doubt.